West Nile to let us know what is happening there in West Nile, especially on matters of health.
Good morning to you, Stephen Bid, and thank you so much for the conversation with the Minister of State for Primary Education, that is Dr. Kaduch. And of course, away from that conversation, we're trying to see what much is government trying to use to ensure that they improve service delivery across the country. And currently, where I'm coming to you live from Koboko district, where we are going to digest on conversation pertaining the health sector. Now, in August last year, the Ministry of Health, in partnership with the CASO and also Koboko district local government, launched training for a group of people who are known as the community health extension workers. And this group will be working right from parish levels. They'll be linking some of the patients to the different health facilities. Now, when you also look at this particular trained group, government is trying to see how can they be in position to address the human resource gap in the health sector. And to have this conversation likely to be joined by Koboko district health educator. I want to understand, if you see at my background, these are bicycles that will be given to this group. And the Minister of Health, that is Dr. Rashul Adidi, is supposed to officially commission this group of health extension workers. I'm told, away from the conversation with the Minister of State for Primary Education, we're also trying to dive into conversation of health service delivery across the different districts. Precisely, I'm coming live from Koboko district, where the Minister of Health, that is Dr. Rashul Adidi, is expected to commission a group of newly trained health extension workers who are known as the district health extension workers. And this group will be linking some of the patients to different health facilities. To have this conversation appreciated, I now have the district health educator for Koboko district. I want to understand, looking at this particular group, how many do we have, and what are some of the issues that we're trying to look at now that we're training this group of health extension workers. Good morning, sir.
Good morning.
What is that you know and we don't know and you'd wish us to know this morning?
Okay, thank you very much. Like for today, today is a big important occasion for Koboko district local government, where we're going to pass out 124 community health extension workers. Now, what we need to know is that we have serious human resource gaps in the health sector. And as we know, most of our diseases are preventable, up to 75%. Now, where are the interventions for these diseases? They lie in the communities. So where we have trained community health extension workers comprehensively to address the issue of non-communicable diseases, including other selected communicable diseases. Now, why we are here is that our health service delivered at community level will improve. Preventable diseases like immunization coverages will increase. The focus of this was initially we had bad indicators following these conditions. So the coming of the CHIWs will address a critical gap that we have been suffering for quite a long time. We are pleased that the Minister of Health has really ensured that Koboko is one of the districts to ensure that we address these concerns, so that in the long run we can also significantly contribute to addressing or realization of the Sustainable Development Goals.
Maybe in seconds, in just 20 seconds, this group will be officially commissioned today. Could we say that this is a multifaceted approach by Ministry of Health, or they have also other partners on board?
Okay, Ministry of Health, they lead, but supported by partner, basically the funding and global fund. So we are working in like a consortium, but the Ministry of Health is the lead to ensure that we address these concerns, and this is supposed to be scaled up, not only in Koboko. And in our vision, we want to ensure that the community agenda, where communities take control of their own health, they create demand for their own health, will improve. When we shall be having healthy communities, then the elderly people will earn, the adults will earn, but the children, when they are healthy, will also learn. And that's why we are saying this is a critical day for us in Koboko to ensure that we celebrate together and follow together how our indicators will change going forward.
Okay, Thank you so much. This has been Idringi Diodone, the district health educator for Koboko district, concluding for us morning at NTV show. Of course, at my background, if you can see, those are bicycles that will be given to this group. And what I've been made to aware here is that government came up with this particular initiative in August last year, and this group that has been trained, it is the government of Uganda in partnership with TASO and also Koboko District local government. For the interest of time, allow me to say that this is where Morning at NTV show for this particular Monday ends. Up next is Mwasuze Mtia with my sister Stella, who will be in the studio shortly. Thank you so much for being part of this show. Catch up with us again at the same time, the same program, and of course we shall be bringing you different current affair issues across the country. Allow me to say that from the entire Morning at NTV show crew, we want to say that thank you so much, and this is where we end. Bye bye for now.